Okay. Okay, that's in focus. That's good. Okay, go ahead. Go on now. So
the Lynn Community Health Center started in 1971 with a small storefront on Chestnut Street that was a mental health counseling center. And it happened as part of the Model Cities program, in which people in Lynn organized because they knew that there were not enough health services in the city of Lynn. And they said the most pressing need at that time was mental health. So that's how we started. And over time, needs were identified by people in this community. That's how it is. That's how we start. Often, you know, in the profit-making community, people look for a need that they can generate revenue from. We identify needs, and then we figure out how we're going to pay for them. That's the difference between us and a not-for-profit and a for-profit group. So we identified needs and figured out how on earth we were going to do it. So we started with primary care, nutrition, pediatric care, and today we are a fairly large organization. We saw 34,000 people last year, 185,000 visits, and dental is a major part of what we do. You think of community health centers as being primary care, providing primary care, the basic doctor's visit. But what we discovered pretty early on was that above the neck services are just as important as below the neck services. And so mental health, dentistry, eye care, all of those things mattered to our patients and were part of the overall health care needs of them. So in in the year 2001, we started a dental clinic with some money that the Department of Public Health identified for community health centers. Our board had said a couple of years before that the biggest need among our patients and among people in the community was a place for people to go for dental care who did not have dental insurance. And there were a ton of people, and there still are in the city of Lynn, who need dental care, who basically are afraid to go to a job interview because when they smile, there are no teeth, who need dentures, need care, and need preventive care. So we knew it was a need. We hadn't figured out yet how to pay for it until the state developed money for dentistry. And we were able to get a hold of a building that was owned by the city that had been a former bar, the Aganis Bar. And and they rented it to us for $1 a year. And we developed 6 chairs in that space. And very quickly it became overcrowded. We're seeing 24,000 visits a year now, and that was in a 2,000 square foot space. And so when the President Obama developed his stimulus bill and the health care reform bill, they put in money for community health centers. And I think that the reason that they did that is because they recognized that community health centers save money. That by doing preventive care, we're preventing people from going to the hospital unnecessarily. And in fact, for every $1 spent in a community health center, that this has been a number of studies show that at least $3 are saved by avoiding unnecessary institutional care. So Lynn Community Health Center today is quite large. We have a WIC program, which is a nutrition program for young mothers and children. We have 6 school-based health centers in the Lynn Public Schools in which we do medical care, primary care, behavioral health, and a little bit of dentistry in some of the schools where we have some portable equipment. And we have HIV program, in which our HIV patients use the dental service, and quite a large primary care and behavioral health program. Apologies for this. And eye care. Eye care is actually one of our newer services, and that came about because the physicians and nurse practitioners who were caring for people with diabetes could not get access to routine eye exams, which diabetics need. I'm actually a patient of the eye clinic and of the dental clinic myself. So just it's the care is first rate, and why wouldn't I be? So this is Dr. Herlevi Linares, who is an energetic a dental administrator, and who helped manage this move from the 6-chair site to our new beautiful space, and who can talk a little bit, I forgive my iPhone noises, and who can talk a little bit about the services we provide here in the dental clinic.